Welcome to all my listeners, and thank you for tuning in and spending some time with me today. This is Doc Dave on Call with Doc Dave, episode number 37 on burns. Okay, so, we've all been exposed to burns probably in the past, usually first degree, sometimes second degree, God forbid third or fourth degree burns, but, burns is fairly common. So, what are burns? They're basically injuries to the skin and underlying tissues. Now, that could be the epidermis, the dermis, or going all the way into the muscles, the vessels, the nerves, or all the way down to the bone. So, we're going to go into detail shortly on, what are the different degrees of burns. But what are burns generally secondary to? What are more common and then more sort of esoteric burns that you could be exposed to? Well, the most common, obviously, are heat or thermal burns. And these are from either hot liquids or flames or steam. Those are the most common types of thermal burns. And they'll give you anywhere from a first to a second to a third degree burn, depending. And then there's electricity. You get shocked, you get a burn. These are somewhat odd burns because they don't really look superficial in nature, and you think, well, maybe nothing happened. But due to the current, it goes down deep into your skin, into the lower levels of your skin, and can cause massive damages throughout your body that you're not even aware of. And that can cause problems with your heart, your kidneys, and we're going to go into that a little more detail as well. Then there's chemical burns. Now, these are either acids or alkalis. And, the acids, believe it or not, are relatively superficial, but the alkalis, which are your base type acid burns, are much more dangerous because they go down deep into the underlying of the skin and they can coagulate the muscle and stuff like that. And then there's radiation burns, sunburns, UV burns, they can be generally first degree, sometimes second degree. So those are the things that cause burns. Now, what type of burns are there? And everybody knows probably, you get a first, second, third degree burns. There's even something called a fourth degree burn. So what are first degree burns? Well, first degree burns are very generally superficial damage to the outer layer of the skin, which is called the epidermis. It causes redness, somewhat pain, and some swelling, but it generally doesn't cause blistering and it doesn't cause any open wounds. It's just kind of like a sunburn or maybe a steam burn, or maybe a slight light hot liquid burn. That usually is your first degree burns. Now, second degree burns, they cause damage not only to the epidermis, but they also go into the dermis, which is the layer underneath the epidermis. So your epidermis is your outside of your skin, the stuff that just sort of peels off periodically, and then your body, develops new layers of epidermis. The dermis is the base underneath the epidermis. So that gets a little more serious when you get into the dermis. And so second degree burns, they can cause pain and swelling just like first degree, but more intense, and they can blister. So if you got a blistering on a second degree burn, then that's a little bit more concerning than if you just have a second degree burn that's a little more painful, a little more swelling than a first degree burn, but it doesn't blister. So the blisters are interesting. In the older days, I've been doing ER for 50 years. Initially, way back when, like I say, the Stone Age of emergency medicine, if you had a blister, the physician or nurse or attendant would rupture the blister, debride it, get all that jellified liquid out from underneath, and it would look nice, but it was more dangerous because now you're opening the skin to possible infection. Anytime you got a closed surface of the skin where it hasn't violated the skin and gone, the blister hasn't ruptured, That keeps the skin more sterile, the burn sterile, and it doesn't allow bacteria to get in and cause an infection. Besides, that little gelatin you see inside the bleb is it's got protein in it, and it's great for healing processes. So not only does it prevent infections, but it promotes healing. So we don't rupture blebs anymore. We actually try to put dressings on them to protect the blebs until they rupture naturally. Once the wound underneath is healed and the fluid under the bleb has disintegrated, then the skin will generally rupture. And then once that ruptures naturally, then you debride it. You clean off the residual gelatin, you debride the residual area of the bleb so you don't have loose hanging skin. You do it under sterile conditions, and then you put some type of a topical antibiotic, either a Neosporin or something called Silvadene. And then you just keep the dressings, you change them every day, you keep it sterile until it starts to heal. Now, 3rd-degree burns. Everybody's heard about these, but fortunately most people don't experience them. Now, that is a full thickness burn of the skin. So not only does it damage the epidermis, which again is your top layer of skin, but it damages the dermis, like in a 2nd-degree burn, but it also damages muscles, vessels, and nerves that are underneath even the dermis. So it'll burn through your muscle, it'll burn through your arteries and veins, and it'll burn through your nerves. This is very serious. And it could either be charred, which is like black, from the like a leathery black reaction from the burn, or it can even be white and blanched, which is even more dangerous. And it generally is painless, believe it or not, because there's damage to the nerve. So it burns actually through the nerve. And obviously, if you burn through the nerve, then you don't have the nerve to transmit the pain signals. So 3rd-degree burn could be painless, and don't let that fool you, because that's even more dangerous, because now your nerve is damaged. Okay, and then there's something called a 4th-degree burn, which a lot of people haven't heard of. And what a 4th-degree burn is, it not only does it go through the epidermis, the dermis, the muscles, the vessels, the nerve, but it burns the bone. I know, that sounds really creepy, but it actually does. And that's, obviously beyond dangerous. You can amputation, or you can be life-threatening injury when you get burns like that. So what are the symptoms of burns? Well, it's pretty straightforward. You get pain, you get redness, and you get blisters. It's common stuff, And how do you treat it? Well, the treatment depends on the severity of the burn, whether it's a 1st, 2nd, 3rd, or 4th-degree burn. Now, 1st-degree burns, pretty simple. You get over-the-counter treatment. So you get Neosporin antibiotic ointment. You can rub some of that on it. You put some aloe vera on it. You could take some non-steroidals if it's bothering you, the pain, the discomfort, some Advil or Aleve or something. And you put some cool compresses on it, 10, 15 minutes, not ice, no ice, but cool compresses, moist, cold water, tepid water, just put it on some type of a dressing and plant that over your arm or wherever you have the burn. Now, 2nd-degree burns. Okay, so now you got the blister, you got a bleb, you try to keep it intact, you don't pop it, you don't rupture it, you don't stick a needle in it, you don't do anything weird like that with it. You put a dressing over that, and that's usually, again, either Neosporin, but generally in the emergency room, we'll put something called Silvadene on it. You don't really need to know what it is. It's kind of a white paste, but it's a little bit more advanced than the antibiotic ointments. And you change those dressings generally every day. You go home from the emergency room, and the nurse will give you a stack of dressing changes and a little tub of Silvadene, and you just change them every day at home. Maybe go to your doctor 3 or 4 days later to make sure it's healing okay. Now, what the second degree burn, say your bleb is already ruptured, it just popped. You didn't do it, it just ruptured, which they will do. And then you have to get it debrided. So that requires you go to the emergency room or something similar to that. If you don't have an emergency room nearby, go to an urgent care, or maybe even your private doctor may decide to do it. So what they do is they just remove all the jellification that's underneath there, clean it all off really good in a sterile treatment, and then debride the loose dead skin around it that's hanging there. You've seen burns before and you get this hanging skin. Well, you got to remove all that stuff because that'll just attract bacteria and trap bacteria. And, that's got to be all cleaned off and debrided once the bleb ruptures. If the bleb isn't ruptured, leave it alone. So, third degree burns, how do you treat those? Well, if it's serious enough, and generally they are, you got to do skin grafts. Because you got to take skin from somewhere else, your abdomen, your back, your thighs or something, if it's a burn on the upper extremity, and then you just do skin grafts. Obviously, that's going to require medical attention, surgical attention, and in-hospitalization. Now, the things also on third degree that you got to worry about is that if it's a circumferential burn, like on your fingers or your toes, if the burn completely, and what I mean by that, if the burn completely burns around your finger or your toes, then that'll cause circulation problems distal to that, and that's very dangerous, and sometimes they have to actually make an incision into that circumferential burn to let the pressure out so that the blood vessels don't get compressed from all the swelling and edema, and then you end up losing, a finger or a toe. So, obviously that's beyond ER work, that requires surgical admission. And then if it's serious enough third degree burn, and generally they are, you got to get IV fluids, liters of IV fluids. They take your body weight and they multiply it by the percentage of burns on your body. There's different percentages. The arms are 9%, the legs are 18%, and vice versa. The anterior chest and abdomen is 18 and the back is 18. Yeah. So, there's a formula for this. They multiply everything out and then they say, okay, you need 10.5 liters of IV fluids because you lose a lot of fluids, get dehydrated, get hypotensive, and it could be very serious. So, and then they also need antibiotics if it's a severe third degree burn, and you need a tetanus shot. Even with a second degree burn, especially if the blood ruptures, get a tetanus shot. Okay, so those are thermal burns. Then you got electrical burns. Now, electrical burns, like I said earlier, are kind of, deceiving because it doesn't really look like much, but as the current goes through your system, say you put your finger in a socket and it goes up your arm and through the nerves and into your chest. And the serious thing about electrical burns is it can put you into ventricular fibrillation. It can make your heart stop. And that's what kills people from electrical burns is their heart goes into fibrillation and could possibly go into asystole, which means it stops beating and you're dead. So if you got electrocution and it's a serious enough one, then you may need to be doing, if somebody's around you, you clear the scene, you make the scene safe before you touch the patient, because you don't want to get electrocuted. And then you do CPR, and paramedics come, they may have to intubate the patient, give them drugs, get them to the ER, and let us do our work. So if it's not to that extent, you still need to go to the ER, even if you haven't been unconscious, because they'll need to do an EKG on you, make sure your heart is transmitting all the electrical components. That's how your heart works. It's like an electrical pump. There's electricity goes through your heart. That's why the EKG, you see all those little blips and bells and stuff like that. Those are electrical currents. And if you get electrocuted and it interferes with that current into your heart, it'll throw the heart into ventricular fibrillation or asystole. So you go to the ER, you get an EKG done, make sure there's been no damage to the myocardium, your heart muscle. It looks like you have a heart attack. Or they'll put you on a monitor for a period of time and just watch your rhythm. Because, like I say, the electrical current could interfere with the rhythm in the heart. It might not show up right away. You might have to watch them for a few hours, maybe even overnight, depending on the seriousness of the burn. So then there's chemical burns. Okay, like I mentioned earlier, acid, alkali, acid, base. The acids are generally more superficial. They cause burning, pain, blebbing, this and that type of thing, but they generally don't go extremely deep. Whereas the alkali, the bases, can be much more serious because they burn through the skin and go into the subcutaneous and into the muscle, and it just coagulates everything into a gel. So you got to put specific types of medicine and antidotes on the alkali burns in order to try to neutralize them and get the pH back to normal, which is 7.0. Okay, so when do you see a doctor? Okay, you see you burned yourself. Oh, God, do I got to go to the ER for this? I got to call my doctor. What do I do? Well, these are things to go to the doctor for. If you have that circumferential burn, even if it's just on a finger, even if it's on your pinky finger or your toe, you drop some hot water on your feet, and you look at it and it goes all the way around, because you got to get that monitored. You got to get that looked at, because like I said earlier, it'll swell, edema, and it'll shut off the circulation. And the next day you wake up and your finger or your toe is white, and that's not a good sign. So circumferential burns should always be looked at. And we say, have a term in ER, like if it's either face, hand, feet, or genitalia, you got to get that looked at. Even if it's a 1% burn, you think, well, it's not that big. But those are the places you get in trouble with. Not so much on your chest or your back or your legs or your arms. Your face obviously could be cosmetic, so you got to get that looked at. Now, also, if it's a deep burn, if it's second degree or more, you should get it looked at by a physician. And because, they may need to debride it if the bleb is ruptured. They got to put the Silvadene on, which is a prescription medication, not just Neosporin. And especially if it looks infected. Say the first day, doesn't look too bad. Next day starts getting a little pus, weepy, red, swollen. You got to get that looked at, because you need to get on not only maybe topical antibiotics, but also oral antibiotics, and that's going to require a prescription, obviously. And the big thing is, if you have breathing issues, obviously it's pretty common sense, but some people, they start wheezing, they just, you got an inhaler or something, they use it. But what we look for in the ER when people come in with second degree, maybe third degree burns, is if they got burning of the nasal hairs, or that black soot around the mouth or the nose, or if they're retracting or having wheezes. This is very serious stuff. These people need to be, possibly intubated, put on high flow oxygen. If not intubated, put on bronchodilators, possible antibiotics and steroids. So if you get that brownness around your mouth or your nose, or the nasal hairs are burned, you can't just deal with that at home. That's serious stuff. So this was good. This was interesting. I like talking about burns. I've always enjoyed treating burns because, it's not only, something that eventually can heal if you do it right, but you're helping the patient, you're relieving the pain, and you're preventing infections, and you're, trying to prevent a second degree to go to a third degree, or a first degree to go to a second degree, because they can go just on their own without even be, a further burn if you don't treat them correctly. So this was hopefully this was educational, informative to you. Keep this one in your file. It's always good to have around. And if you liked it, hit that like button. Got to have likes, and subscribe, because I've got more interesting topics coming down the pike. And thank you for your time today, and we will talk again soon. Remember, I am your doctor. I am, no, I am your friend. Yes, I'm definitely your friend, but I'm not your doctor, okay? So always consult your physician if you have any questions. Thank you very much.